been diagnosed with sleep apnea, you are not alone. Sleep apnea affects millions of people, men, women, and children. Your physician has prescribed positive airway pressure therapy for your sleep apnea. We often abbreviate positive airway pressure therapy as PAP therapy. With sleep apnea, your airway closes up on itself while sleeping. It interrupts the flow of your air and you don't get the right amount of oxygen. This causes you to have interrupted sleep and you wake up feeling tired. Positive airway pressure therapy works by keeping your airway open while sleeping. It delivers pressurized air, which keeps the airway open so that you get the right amount of air and oxygen that you need. You should then wake up in the morning feeling refreshed, energetic, and ready to start the day. During this video, we will cover the following topics: types of machines, heated humidifier, machine controls, accessories such as tubing, filters, and modem, choosing your mask, maintenance and cleaning, what to expect, and insurance requirements.
There are several different types of machines that may be used to treat sleep apnea. The physician determines which machine will best treat your apnea and provide you the most comfort. CPAP machines provide one constant pressure throughout the breathing cycle. BiPAP machines provide one pressure when you breathe in and a slightly lower pressure when you breathe out. Auto machines are designed to vary the pressure throughout the night. BiPAP ST and ASV machines provide the pressure to treat the apnea and a set number of breaths during the night.
The air you normally breathe is humidified by the environment. A heated humidifier is provided to prevent the drying of your nose and mouth. A heated humidifier is added to your PAP machine to increase the level of humidity. The warmer the water, the greater the humidity. The humidifier water chamber is marked with a maximum water fill line. Remember, do not overfill the humidifier. Use only distilled water in the humidifier. The amount of water remaining in the humidifier chamber after a night's sleep will be dependent on the heater setting as well as the temperature of your room.
I would also recommend to use the humidifier feature. I started this at the end of a winter season when the air was quite dry and found that really did help quite a lot.
The respiratory therapist will preset the PAP machine according to the prescription provided by your physician. They will also show you how to adjust the settings to improve your comfort. Your PAP machine will have a main control knob for turning it on and off. There's a digital display window that will show the pressure set on the machine. This window may display additional information depending on how your respiratory therapist sets the parameters. There's a control dial for setting the temperature of the humidifier heater. Typically, this can be adjusted from the off position up to a setting of 4 or 5, depending on the model of your CPAP. Remember, the higher the number, the more heat and the more humidity. A ramp button is marked with a triangle. This is a special comfort feature that will help you adjust to the pressure more easily. The ramp will cause the pressure to decrease to a lower level and then gradually increase to the pressure level prescribed by your doctor. The respiratory therapist will help you determine how this can best be used.
Your PAP machine requires a filter to protect you from dust. This filter is usually foam. A second optional ultrafine filter may be provided to help trap particles that may trigger allergies. PAP tubing is connected from the outlet of the machine to your PAP mask. Attached to the back of the PAP machine may be a modem or an SD card. This can be used to create a report of your PAP usage, which your physician or insurance company may require at a later time.
There are several different types of PAP masks available. Choosing the mask is one of the most important decisions that you'll make. Begin by asking yourself a few questions. Can I breathe comfortably through my nose? Do I have frequent nasal congestion? Do I have nasal polyps or a deviated septum? Do I breathe more through my mouth or my nose? Am I claustrophobic? Do I prefer to read or watch TV when falling asleep? The answers to these questions will help you and your respiratory therapist select the best PAP mask. To use a nasal mask, you must be able to breathe clearly through your nose and keep your mouth closed during sleep. The full face mask allows you to breathe through both your nose and your mouth. Your first decision is, can I use the nasal mask or do I need a full face mask? If you're not sure if your mouth stays closed at night, but you can breathe comfortably through your nose, then the respiratory therapist can provide a chin strap that will prevent your mouth from opening. The second question to answer is, am I claustrophobic? The nasal masks are generally smaller and less cumbersome on your face than a full face mask.
I definitely was not going to start out with one of these because I would feel like this was like too much. But by the time I got to this, I could at least try it.
Thirdly, if you read or watch TV at night, there are both nasal and full face masks that are designed to interfere less with your field of vision. Once you have discussed these factors with the respiratory therapist, you can begin to look at your specific mask options. Choose a mask that fits well, does not leak around the mask, does not cause facial discomfort, and the seal can be achieved with minimally tightening the straps. Nasal masks fit over your nose. They have a forehead stabilizer bar and a head strap to hold it securely on your face. Nasal pillows fit into the tip of your nose. The strap fits over your head. These are very lightweight and overall less obtrusive. Full face masks fit over your nose and your mouth. Most have a stabilizer forehead bar. They are the mask of choice if you must breathe through your mouth.
Proper care and cleaning of your PAP equipment is essential to extending the life of the machine and to your success with its use. Daily cleaning is simple. The soft cushion of your mask or nasal pillows should be removed from the frame and washed with mild soap, rinsed, and dried. The humidifier chamber should be emptied, washed with mild soap, rinsed, and fresh distilled water added each night. Additional cleaning is needed on a weekly basis. The mask frame and tubing should be washed with mild soap, rinsed, and dried. The foam filter should be cleaned by dusting off or washing with mild soap if needed. The humidifier chamber can be washed in the dishwasher if the chamber lid can be opened. If not, then the chamber needs to be soaked with 1 part white vinegar and 3 parts tap water for 30 minutes and rinsed well. Your mask headgear should be hand washed as needed with mild soap. Placing the head strap in the washer and dryer may result in damage to the Velcro. On a monthly basis, the ultrafine PAP filter should be discarded and replaced. Avoid using chemicals such as alcohol, bleach, or peroxide on your equipment. This is for your safety, as well as extending the life of your supplies.
It is very important to recognize that each person adapts to PAP therapy differently. There are several challenges you may face while learning to adapt to your PAP therapy. You may have difficulty falling asleep. It may feel difficult to exhale against the pressure. You may experience mouth or nose dryness. The mask may leak, and you may feel some facial discomfort. These concerns are normal, and there are ways to help you overcome them and be successful with your therapy. It simply takes time to adjust to this new therapy. Commit to using the PAP every night for as long as you can. A night will come when you sleep through till morning. Be patient with yourself and allow yourself time to adjust. New habits will be formed, and some of your old sleeping habits may need to be changed. It's helpful to start your bedtime routine about 15 minutes earlier.
Within 10 days to 2 weeks, I was sleeping without even thinking about it. It was part of my routine.
Prepare your PAP machine by adding distilled water to the humidifier chamber. Initially, set the humidifier heater to a medium setting of 3. Apply the mask to your face and turn on the PAP machine. Adjust the head strap to seal the mask and prevent any air leaking. If the set pressure is uncomfortable, activate the ramp feature.
What the ramp feature does is gets you there over a period of minutes at a much lower pressure, so you can most likely fall asleep breathing relatively normally before the real pressure kicks in.
You may need to adjust your sleeping position to allow the mask to rest comfortably on your face without leaking. You may need to readjust your straps after positioning yourself. Your sleep apnea symptoms should be controlled by your PAP therapy, depending on how many hours you sleep with the mask on your face. When you're new to the therapy and are able to tolerate it for several hours, you may not notice a significant change in your symptoms. As you work towards using the PAP all night, you should notice improvements in how you feel. As you increase your PAP machine usage, you may experience the following positive improvements: less snoring, sleeping more restfully, waking up more refreshed, having less daytime fatigue, and a higher energy level. It is important for you to know how to correct the most common problems you face with PAP therapy. Waking with a dry mouth or nose is corrected by increasing your humidifier heater setting and checking to be sure that your mask is not leaking.
Listen for the leaking. You'll hear the psst. You shouldn't be hearing that sound.
Mask leaking can usually be corrected by adjusting the head straps. If you develop a tender spot or redness on the bridge of your nose due to the pressure of your PAP mask, you can usually adjust the head straps to correct the problem. However, if you notice any abrasion, skin tear, or blister on the bridge of your nose, it is very important to stop the therapy and contact your respiratory therapist. They may be able to provide a gel cushion to help protect the area, or occasionally the mask will need to be replaced.
Your PAP disposable supplies should be replaced on a regular basis. Mask cushions can break down over time, causing them to leak. Tubing and humidifiers can collect moisture, and it is possible for bacterial contamination to occur. Each insurance provider has guidelines when they will reimburse for replacement supplies. Your respiratory therapist will provide you with a list of when supplies can typically be replaced. Your respiratory therapist will monitor your PAP usage over your first 3 months of service. This information will be provided to your doctor to help with assessing your progress. Your insurance company may use this information to determine coverage. The current guidelines being used for this purpose require you to use the PAP for 30 consecutive nights for at least 4 hours each night. You will need to meet these guidelines within 3 months of receiving your machine. If you do not meet your insurance provider's usage requirements, they may elect not to cover the cost of your PAP. The cost of paying for the equipment would then become your responsibility.
Using your PAP therapy will help you feel better overall, improve the quality of your life, and keep you healthy.
Once I became acclimated to the CPAP, it was a whole different world. I know that I would never want to go a night without sleeping with it.
Knowing that I'm getting a more full night's sleep with fewer of those wakings has increased the energy level, and I just feel better.
Remember, you're not alone when it comes to the diagnosis of sleep apnea, nor are you the only one on PAP therapy. This is a lifestyle change and can take some time getting used to it.
You just have to keep saying to yourself, I know I'm doing the best thing for me, and make it almost part of your life. It will just make it so much easier to adjust to it.
We are working together as a team to help you use your PAP therapy whenever you're sleeping so that you wake up feeling refreshed, energetic, ready to start the day, but also keeping you healthy down the road.
Hello, it's me.